Hi everyone, I hope you're having a great day. Today I wanted to talk to you about, are you being the CEO of your health? Now, I'm Kojic Semi and I help people reverse and release chronic pain by finding the root causes. And I really wanted you to reflect on this question and think about it. Because of the experiences that we have, we don't often think about our approaches, what we want and what's important for us when we think about our health. So most people, they go to the doctor and they hand over all the responsibility for their health over to the doctor, the medical professional, practitioner, the specialist, whoever it might be, and we start taking a back seat. Now, I want you to think about this because I did exactly that. When I had fibromyalgia, I literally went through my GP, went to specialists, consultants, and all sorts of specialists in all sorts of departments of the hospital, and I literally gave all the responsibility for my health over to them. All I wanted to know is what was wrong with me and what they could do about it. Okay, so I wanted a pill, a magic cure, whatever it was, and that was how I approached it without thinking. So being the CEO of your health is very different. And I want you to see if you relate to any of this, whether you do think about it or not. So Chris Carr, the author of Crazy Sexy Cancer, she coined this phrase, the CEO of your health. And it's like being in charge. You're the one who needs to be in charge. This is so key, because if you're not, you're putting that responsibility onto somebody else. And who knows you best? Only you do. So you know whether taking medication is something you don't mind, I'm not going to say enjoy, something you don't mind, or whether it actually goes against you, because a lot of us don't actually like or want to take medication, yet that's our first route. So I want you to think about how you approach your health. Are you taking charge, and are you being the CEO, the head of your health? Because only you know your thoughts, only you know your emotions, only you know what's going on around you in your environment and what affects you. So there's no one else who knows you like you do. You know what triggers you, what causes stress, what causes symptoms. You're the one experiencing it. So I really want you to think about how you approach your health. So everybody is conditioned that when something's wrong, we go to the medical professionals. And that's exactly what we do. And that's great. There is absolutely nothing wrong with that. But I want you to think about how you're approaching that. So for me now, after my fibromyalgia and recovery, I changed my approach because that approach didn't work for me. Doing something the way someone else wanted me to, taking medication, it didn't work. It literally made me feel worse. And I had to look at, actually, I don't like taking medication, so why is that my only option? And it's when we start thinking about it and reflecting on it and thinking about what's important to us and what we want for us, it can change everything. It changes your approach. So now when I go to the doctors, which is few and far between now, but when I do, I actually go to gather information. They do know more about conditions and labelling conditions and the medications that are needed. They do know more about that, but they also only know what they've been taught, what they've learned. And I've learned to heal my symptoms. So I've learned things that they might not know either. So what I do now is I don't give give that responsibility away. I don't give my power away to someone who I used to perceive in authority, kind of higher than me, knowing better than me, because that takes you out of the equation and it says what you want. It doesn't matter. It also actually cuts down your options, because when you're approaching it in a way that everybody approaches it, just because we're conditioned to that, those are the cultural social systems that we all live to, because we've always done it and we've seen our parents do it and our grandparents do it. It's just almost habit. It's just something we do without thinking. So I want you to start thinking and reflecting. So I'm not saying don't take medication and don't go and see them. I want to be absolutely clear. There's important information for you. And when you go there and you're the CEO of your health, you're taking charge, you're really going to gain information so that you can make those best informed decisions for you. What approach would you like to take for your health? What approach would you like for your long-term health? This is so important, and it's something we don't think about. It can literally change the outcome. So for me, I decided I had to find another route, that couldn't be my only option. There was something that they didn't know that I needed to find, and I wanted to find the root causes for me, because I never wanted to experience that ever again. And actually, I got to understand myself more. I got to take charge, because now it was down to me. And I think that's really important, because although it wasn't easy, I had a lot to learn. It was very empowering, and for my long-term health, it's changed how I learn. I learn from my experiences. It's changed how I approach things. And I actually sit and think about what's important for me, what resonates with me, what aligns with me, and what experience I have from what I'm doing. So now I take information from all these sources, and not only the medical practitioners. So this is just a short video that I thought would really help those who are struggling with chronic illness or chronic pain, because this is right at the start of how you go on to deal with your symptoms. And it can make a huge difference when you're clear, when you know what you want and how you want to approach it. It can make a huge difference. And I've seen that just this change in perspective and this clarity actually lead to huge acceleration of recovery with my clients. So if you feel this is useful, please leave a comment. I love your feedback, and it's great for me to keep going with things that might be helpful, that I notice in the work that I do. And I'd love to hear from you. If you have any questions, leave a comment and leave it with me, and I will do a video on it so that I can bring the information and share with you what I learned that's empowered me, not only for my complete recovery from severe chronic pain and all sorts of symptoms, to actually something that's going to lead to improving my long-term health for many years to come. And it feels absolutely fantastic. So please share this if you feel someone else might find this useful. And you can find me at centrebalance.co.uk if you have any questions. Thank you so much. Have a wonderful day, and I hope to hear from you soon. Take care.